Hi, we're welcoming you to the John and Michelle show. I don't know, we haven't come up with a name yet. If somebody comes up with a name, let us know and we'll consider it. So,
I'm having tea and I'm in my comfies.
your comfies, is that what you're calling yourself now?
Well, I got the sweats on.
I don't know, that still sounds super weird. Comfies, like you're 5.
You know where I took it from?
Where?
No, I can't think of her name.
Of course not.
Your Jewish friend, Cynthia?
Cynthia?
Yeah.
She said that?
She did.
Oh, that's so weird. She's so
When she came over to clear up, she's like, "Oh, I switched into my comfies."
Oh. Huh. Okay, well, anyway.
Well, massively off topic, apologize.
Okay, so we're gonna do health. We're gonna address healthcare today in our 5 minutes. So we got our Blue Cross Blue Shield bill, and in 2013 for 4 people, 1 minor, because Miriam was 18. It was like $350 a month. And I think the deductible was like $3,000 with a $5,000 max out of pocket for family. We took Miriam off. And last year, for 3 people, 1 minor, it was 6 and change. So it went up from $350 to 6 and change, so about $300. And then this year, it's gone up to $900, $870 something. And next year, January 1st of 2016, it's going to be $1,279.09.
Or what I call $12.80.
$12.80, because it sort of sounds like an experiment or something. So we talked to the insurance guy. So there's money that you can get from the exchange, I guess. I don't know, where do you get this money? Where's this money coming from?
Well, it's MNsure, but it's ultimately taxpayers that are doing the subsidy.
Okay, so the taxpayers would give John and I and our son let's say $200 a month. Rounding up or down, just whatever. $200 a month to buy insurance. But our premium is $1,300 a month. So we have $200, so what? That's $1,100. I mean, that's still a ton of money. And they're saying that, health care should not cost you more than 9% of your income. But what they don't want to tell you is...
Unless you get sick.
Yeah, is this lie that, okay, you can each get separate policies. So I figured out, the 3 of us, about $700 a month. But John found something cheaper, so $600 a month. Okay, well, $100. So, sure, that saves some money, but still, $600 a month, $600 a month, and change, so it's 6 and change. But the deductible is $6,500 per person. Per person. I mean, if my deductible is going to be a little bit higher, that mine was more like, I don't know what it was, but it was expensive. We'll stay on that 60.
They were all like 6,200, 6,800, somewhere on that.
All right, so if we do 7,000 times 4, or times 3, I mean, that's $21,000 out of pocket.
So, don't get sick. That's the Obamacare plan is, don't get sick.
So we talked to the insurance guy today, and I said to him, how are people supposed to afford it? And he said, well, it's not supposed to exceed over 9%. And I said, but what if you're going to use X because, your deductible, you're going to use your deductible. And he was like, yeah, you're going to have money then. Oh, well, tough shit. It was like this lackadaisical, he hates Obamacare, sure, but I don't even understand. There is no solution, basically. It was just sort of like, tough shit. So what?
I got 6 stinky choices, and you can pick the least stinky of them all, but it's still gonna smell.
Yeah, it's just so obnoxious. So now shopping for healthcare has become a commodity. That's what all these are. They're commodities.
Right.
That's exactly what I thought when Obamacare got passed and the exchange rolled open. It was just a bunch of commodities. And now our insurance guy's like, I've been doing this 30 years, I got the back door in, and we go in, and I don't know, it's the same stuff we can see, so I don't know what back door he was talking about.
The reality is we're gonna have to accept a larger amount of liability for about what we're paying right now, if not a little bit more. You know, God forbid we want to keep our existing plan, well, that would cost us an arm and a leg.
$15,000, I thought we figured out.
Yeah.
Okay, so this is my question. Why is the federal government looking at this as a well, okay, in the state of Minnesota, if you're making $65,000 a year, you're gonna get $200 about. So what I said earlier, which was then that'd be $1,100 for our current policy. Where do we get all that extra money? And they're insane. I mean, what are they doing? What are they basing this on? They're basing it on a limited amount of policies, and those are the policies you have to get. Which is just, what is that about?
We couldn't even keep our existing plan and do the
200. No,
it was like 250 or something, because
it was 233.
It's not part of the exchange, so it doesn't count towards the subsidy.
And the policies that are on the exchange, they all suck.
Yep. So I'm not sure how this is progress by anybody's measure. It doesn't sound like anybody's happy about it.
Oh, and the insurance guy said that they ask you like 5 questions just to do your password. He made it sound like it's a real pain in the neck.
Like you gotta schedule off an afternoon to
yeah, and then he said they do a soft pull of your credit bureau report without asking you permission.
And then they'll ask you about that loan you had from 2002. That's right, 2002.
13 years, but apparently they can still bring it up because it's financial data, and that's the thing. Sarbanes-Oxley sort of regulated financial data, but I gotta tell you, there's a lot of places that financial data, it's 20, 30 years that they have, John. They don't throw it out.
No, they don't.
Not a bank, not a financial institution. Does that make sense?
Oh yeah.
So I don't know, that's... Okay, so what are Americans supposed to do?
Well, evidently, if you're working a regular American job, you need to quit your job and go on public assistance, because then you can get free health care. Or you need to get another job so that you now work 3 jobs, and one of those jobs can pay for your health care. Of course, you'll have no time to sleep, but that's not...
You don't have a second job, so you can't speak. Let's talk about people in our income bracket, John, not somebody else that has a third job. Please. People in our income bracket that, got hit with the recession.
I don't know, sell some retirement you don't have.
God, that's messed up, isn't it? I mean, sell retirement to pay for...
Or I guess you take the cheapest plan, and when you do go to the doctor, you don't pay for the bill because you can't afford to.
Like Nikki.
Like Nikki.
See, that's what I was thinking when I was talking to the insurance guy. I was thinking about her, and I was thinking, That's not us. But she said that the MinCare was just a tedious situation, but she was going to have to see if they could figure it out. And I think what frustrates her is that, sure, she could get a little bit better of a policy, but she's still looking at a lot of money for a deductible. So she's looking at $10,000 with the MinCare money, right?
Right.
Instead of $15,000 out of pocket. So she's still in this, I don't have the money to pay these doctor bills. These doctor bills 5 years ago for me were free. Now they're costing me thousands of dollars. I mean, can you imagine being somebody like that that's so out of touch? That's most of Americans. That's why they stopped sending you your damn bills in the mail and EOBs and stuff from the clinic. They stopped because people don't understand this stuff. They don't understand any of this stuff.
Well, why would you want to know that it's covered? Right?
Because when something like this happens and now you don't understand why everything used to be covered and it's not covered now, when you're aghast that a procedure that would have been covered 5 years ago for you is not, because your healthcare insurance has degraded over 5 years.
Right. Oh, and guess what? Now if you don't have health insurance, you're going to get penalized on your federal taxes. How is that a good idea? How is that helping people who are already not getting by to tax them more?
I have no idea.
I mean, whose idea was that? Obama? What were you thinking?
Except, you know what? A lot of these people that don't have any insurance are fucking idiots. Let's be honest. They're idiots like Jeff Earl that are willing to take a chance when Jeff knows better because he didn't have health insurance and it blew out all the money he had invested when he broke his ankle falling from that scaffolding, remember?
Yeah.
So Earl fell, spent like $40,000 because of, that's how much everything cost because he didn't have medical.
Right.
And so I'm sorry, but a lot of these people, that's the average person. The average person isn't you and I that understands that going to the doctor costs a lot of money. And that's what I'm trying to exploit on when I'm like fighting this one bill, the ER bill, is, nah man, I'm going to play dumb. Why should I be charged $166? She didn't do anything for me. This is the only occupation where you don't do anything, you just walk in the door and you're charged. What other job does that to you? What other? Where?
Yeah, you got me. Nowhere. Just healthcare.
She did nothing for me and she's charging $166 for what? Okay, so my question still stands. What's the average person that makes decent, over $50,000 money to do when sure they can subsidize, if we're taking it from Nikki's perspective, right? They can subsidize me. I could get a little bit better policy, but I'm still going to owe $10,000 now. I mean, this is out of my reach. She sees Merlin once a month because he does everything. She's now going to go to him for doing her Xanax because her private practice psychiatrist is just too expensive. She doesn't have the money. Merlin's much less expensive for more time.
Yeah.
So you would think there'd be a push for more people like Merlin because that's the only reason I feel comfortable having us have higher deductible policies is because we have Merlin. We can always go in if we got a cough or whatever. We've used up our 3 visits going to the Minute Clinic. Merlin can see us for $80. It's not like this debilitating, you have no idea doctor visit.
Right.
Well, they took some blood work, and that's $700. And then, remember, like, my OBGYN visit that they told me I was supposed to run $400 or under, that ran $800? And we fought them, and we got them to, like, 5 something, and I finally paid the damn thing.
Yeah, I do.
And they couldn't even answer, like, what was the deal.
Unfortunately, even the catastrophic plans are barely affordable.
This was supposed to be a half an hour. Okay. Well, that's okay. That's 15 minutes. We can do 15 minutes. Okay, so how do you want to...
So, to summarize it, the Affordable Care Act is not really affordable care. It's just more of the same, except it's jammed down your throat now. That notion of, oh, you can keep your current policy, well, it's just not true, because your current policy is going to take your rates and double them every year to the point where you really don't have a choice to keep that policy. That's what's happened to us, and I'm sure we're not the only people. You go on the exchanges, and the exchanges only really offer these plans that leave you with, frankly, quite a bit of exposure if you do actually need something beyond an office visit.
What do you mean by quite a bit of exposure? I think that's a term that some people won't know.
You're paying 20%, even when you hit your deductible,
up until like $15,000.
Up until like a $15,000 out-of-pocket maximum, at which point, if you're the average American, you are flat-ass broke. And you're selling your car and anything else that's not bolted down to cover those costs. And that's for a plan that's already going to cost you monthlies that may be approaching your mortgage and other things that are necessary. How other countries can manage to do this and we can't, I just throw my hands up. What? We spend too much war on Iraq, too much money on the Iraq war, and now we don't have health care? Where are the adults? Where are the grown-ups? Did they all leave the room and so nobody told us? Oh, we're going to go spend $1 trillion on a war based on a bunch of lies, and oh well, whatever happens, happens. Sorry, you can't go to school because there's no more funding for higher ed. If you get sick, well, you're screwed. And, well, at least Iraq's safer now.
Wait a minute.
Oh wait, that's
yeah, but you know what?
True.
But you know what? We're not getting into that because then that gets in the whole Bush-Cheney thing, and they screwed that up. So they screwed the pooch. This sounds real liberal, I know, but we're not, liberal leaning. Just because we believe in one payer health system, it's only because we can't go back to what we used to have, and we sure as shit cannot keep the current healthcare system the way it is. A lot of us are going to have to say no more and not pay our bills. Just not pay our bills to the doctor or the hospital or whatever. Just say we're done and go to minute clinics. This is what we have to do. We have to start taking a position. We have to say, what's better for our health? Well, you start taking vitamins, exercise, eat good, eat fruits and vegetables that are in season, and barring not in season, make sure you wash them, because a lot of people can't afford to eat organic, and I get that. So, I feel like you need to start taking your health in your own hands. Otherwise you're going to be suddenly $100,000 in debt, and there's no way out for you. I can see us
we need
going
real
down that
cost
road.
control. That's really the drama.
Yep, and I think it's Americans that have to band together and do it.